Well, so there's a conspiratorial frame of mind here, which is given just enough Pavlovian reinforcement to be almost impossible for people to break out of, because there are occasional conspiracies. There are certainly bad incentives that can be detected where it's easy to allege a profit motive on the part of Pfizer. I mean, so you referenced the fact that Pfizer was prematurely recommending booster shots, right? Well, the reason for that is, the cynical reason for that is fairly obvious to
Hmm.
see, because this would mean literally billions of dollars falling to their bottom line if that were our health policy. And so there's this background concern about a profit motive in medicine that is deranging people's thinking here. And I mean, so Brett Weinstein is an example of this. I mean, I know that he's very concerned that the emergency use authorization for these vaccines required that there be no valid therapeutic for COVID in order to get triggered. And so, by definition, this is on his account, by definition, it had to be judged that there was nothing in the armamentarium of medical science that could treat COVID in
Right.
principle in order to fast track these vaccines. And therefore, we overlooked the near panacea of ivermectin, an old compound that is generically available and from which no pharmaceutical company stands a chance of profiting. And so there, in Brett's mind, you have the perfect storm of bad incentives and greedy pharmaceutical executives driving policy toward windfall profits and disregarding the life-saving opportunity of handing out ivermectin to one and all, and driving us toward some kind of abyss of novel risk, right? Because on his account, these mRNA vaccines are new and therefore have to be assumed to be dangerous because they by definition are untested, or we're testing them on ourselves now on his account. So this is where we have to deal with the claim about ivermectin and why it's not a rational alternative to these vaccines.
Yeah, well, I do want to go over this because the notion about the emergency use authorization is incorrect. Firstly, that is the definition in the setting of a pandemic or a crisis for the FDA is may be effective. That's all it takes. May be effective. It doesn't have to be that there's no other treatment.
Mm.
Okay. As long as something may be effective in an emergency situation, the FDA has the ability to push forward, as they did. You may recall, they gave an EUA for hydroxychloroquine.
Mm-hmm.
They gave an EUA for convalescent plasma. There already were other things, like, for example, when the convalescent plasma was granted, which was wrong and had to be withdrawn, as was a hydroxychloroquine, both of those there were other things out there for treatment. That is,
Right.
when the plasma, there were already, so, we've been through this where there were all sorts of sense, whether it was then president or other people following the president, that hydroxychloroquine was, some magical drug. And it proved not only to not have an effect, but to also have some dangers. The convalescent plasma, where over 600,000 Americans got convalescent plasma because of a tortured data analysis without a randomized trial. That was given an emergency use authorization, which promoted hundreds of thousands to get the treatment
Mm-hmm.
and may have actually helped to spur on these variants because they were getting these polyclonal, antibodies that certainly wasn't helping the situation, helping them. So, then comes ivermectin. Now, I've reviewed that data carefully because, you know, on Twitter, if I put anything on Twitter, I usually get at least some comments about did they get ivermectin, or if only
Mm-hmm.
they had ivermectin. If they all had ivermectin, no one needs a vaccine. This kind of stuff, right? I said, where did this come from? So it turns out, there are a bunch of small studies, right? And they've been meta-analyzed multiple times by different parties. And, I think the best raking over of the data was by this fellow Gideon Meyerowitz-Katz, who put together is ivermectin for COVID-19 based on fraudulent research. And that was just, earlier this month on a Medium. Now, in it, he takes an unbiased view and very careful view of ivermectin, which is an anti-parasitic medicine, as you mentioned. It has been used for river blindness. It is used for lice. It is used for, various parasitic diseases. And it's relatively safe. I mean, there are some serious side effects, but they're uncommon. Now, the point here is that what about these trials? Do we have any large trials? The trials like, I did one of the largest clinical trials in medicine with 41,000 patients in 18 countries around the world for heart attack. And, I know what a large trial is when I see it. Mega trials, over 10,000, which is what you want and what the UK has done in the recovery trials. We haven't had one large trial in the whole COVID-19 pandemic done in the United States. But these trials of ivermectin are exceptionally small. And the largest one was this one from Egypt, which Gideon Meyerowitz-Katz shows was highly irregular. 1/3 of the people who died from COVID in the trial were already dead when the researchers started to recruit them. I mean, these are, you just don't see this kind of stuff.
You need
Sam.
a time machine to run that trial.
You have, quote, if this is an outright fraud, the ethical concerns of randomizing people into a clinical trial before the ethical approval comes through is enormous. And, his piece, takes this apart in terms of the fact that this trial from Egypt, the largest, which isn't large at all. I mean, just, a few hundred people in either arm of ivermectin. This is not what you would call any evidence for making ivermectin a standard drug. Now, I see a signal there that ivermectin could be beneficial. I don't know why. I don't know the mechanism. And I would also hasten to add that, our place and many others have raked through every drug known to mankind for repurposing. That is, most molecules, drugs have been characterized. We know their structure, and we can match up whether it would work against this virus. And ivermectin has never shown up, despite hundreds of others that have, for having an antiviral specific qualities. But putting the biology aside, it looks like there's a signal. But for anyone to say that this should be given universally, and as Brett Weinstein has said, and others, that it's 99% effective, there is no drug that's 99% effective known to man. And then to say it reduces mortality or improves survival by 70, 80, 90%, these are impossible. They have never occurred. This is, just not acceptable.